Thank you, Rebecca, and good morning, everyone. The South Dakota Department of Health has thrived in bringing South Dakotans and our media the most up-to-date health information as it becomes available. To that end, here's the latest statewide COVID-19 information. New confirmed cases, 141. New probable cases, 68. Active infections, 2,552. Recovered cases, 104,305. Currently hospitalized, 133. Total tests performed, 882,942. Total persons tested, 404,367 unique persons, with 108,639 positive cases, 295,728 negative persons. We are currently reporting the RT-PCR positivity rates since the measures being used by the CDC as well as CMS for nursing home and long-term care facilities reopening plans as that number.
When do you think you might be able to?
If you could please mute your lines, we appreciate it. That last 7-day number, as of this morning, is 7.6%. Additionally, 104,604 doses have been administered to 73,553 state residents. As a reminder, the provisional data reporter can be found on our COVID-19 dashboard, which is updated daily and found at doh.sd.gov. We'll now turn it over to our state epidemiologist, Dr. Joshua Clayton.
Thank you, Daniel, and good morning, everyone. Just wanted to provide two quick updates. One relates to our rate of cases. So the rate of cases over the past week has decreased. We've seen about 1,000 cases identified over the past 7 days, and this is a decrease of about 33% from about 1,500 cases in the week prior. It is important, as we're seeing these decreasing cases, that prevention measures are still taken. That does include individuals avoiding crowds, maintaining 6 feet distance from other individuals when that's possible, wearing a mask when those two activities are not possible, making sure that you're staying at home if you're sick, washing your hands often, and cleaning high-touch surfaces that you might interact with on a regular basis to avoid any potential transmission. The other activity in regards to that is vaccination, and so we do continue to provide vaccine throughout the state. We do have a very high uptake of vaccination within our population, and we continue to provide updates on that on our covid.sd.gov website. The second thing I just wanted to mention is an update on strain surveillance. So we do know that the B117, which is the UK variant, that we currently have 541 cases in 33 states. Now that variant has been identified in the surrounding states of Iowa, Minnesota, and Wyoming. Based on the CDC projections that were released in the recent MMWR article, which we've covered previously, the variant is expected to become dominant in the U.S. in March. So we do expect to find the B117 UK variant in South Dakota, but have not yet done so. In order to find variants such as this, we do continue to collaborate with CDC to do testing of a select number of specimens that are received by our South Dakota Public Health Laboratory. And the last thing that I just wanted to mention is a thank you to everyone as we are working through seeing decreasing cases, that mindfulness of that we still see high levels of transmission. You can take a look at that by looking at our map of communities with substantial level of community spread. And so, one of the best ways of preventing COVID-19 are the measures that I mentioned, as well as getting your vaccination when it becomes available for your priority group. So with that, I will turn it over to Secretary of Health, Kim Nelson-Reisen.
Thank you, Dr. Clayton, and good morning to folks who are joining us. Before I get into some exciting news, I just want to highlight, since our last call, over 104,000 South Dakotans have received the COVID-19 vaccine, with over 73,500 getting their first dose, and the rest getting their completing their course of 2 doses. So our state remains in a strong position nationally in this effort, and again, that's due to the sacrifices that we're all making in terms of the general public, continuing those mitigation strategies that Dr. Clayton talked about, the work of all of you in the media to get information out in a timely way, and of course, all the hard work among our healthcare professionals across the state. This week, our weekly allocation of vaccine is 12,850 doses, and again, the second doses that correlate to these first doses will come out in 2 to 3 weeks, and so we so far have been able to count on that. Next week, we will see our allocation slightly increase to 13,550 doses. So this is obviously good news for South Dakota and for getting shots in arms. The other announcement, which is exciting, is that the federal government will be activating its federal retail pharmacy program for COVID-19 vaccinations. And so that will happen next week, and it could be as early as next Thursday, February 11th, that we will see a limited number of retail pharmacies statewide have access to some vaccine. Now, we don't know yet which locations will be participating, but we do know that this initial rollout will include pharmacies located in Walmart stores across the state, Hy-Vee locations, Lewis Drug locations, and a number of pharmacies who get their drugs supplied by Cardinal Health. So be on the lookout for a press release on this program early next week when we have more information about which specific locations will be participating. The allocation issue remains an issue for them as well, and so the way that this will work is that the federal government will be allocating vaccine directly to these retail pharmacies. That allocation will not come out of the state's allotment, so that's good news. But nevertheless, the overall allocation is expected to be quite limited as this gets started. But nevertheless, increased access points to the vaccine just means an increase in shots in arms, and we think that'll add convenience to South Dakotans who get vaccinated. The other thing that's exciting is that we are ready next week to start inviting people age 75 and older to be vaccinated. So as we've talked before, this is a relatively fluid process, and so anybody that is in the 1A, 1B, 1C populations, and anybody over age 80 who has not been vaccinated yet will still be eligible. So, we really encourage people that maybe had access before but weren't ready or just weren't able to become vaccinated. If they're still interested, they can still be vaccinated. But we will also be inviting people age 75 and older to be vaccinated starting next week. Immediately following this briefing, all of those who are registered for this will be getting an updated infographic for distribution. And so, I guess what I would say is, given allocation, the retail pharmacy program happening, and just the progress that our phase 1 vaccinators are making, we're excited to be able to make this adjustment in eligibility. Now, one of the questions people sometimes have is, what priority group do they fit in? And so another thing that we've worked on here in the last week, and Daniel, thank you for your team's hard work on this, is a tool to help residents identify which group they are in. And so look for a press release on that coming out this afternoon as well, and we hope that proves useful. Last thing I want to just mention is our volunteer portal, and so thank you for helping us get the word out. We talked about this just 1 week ago, and we've already had over 2,300 residents who have stepped up to volunteer in their communities. And again, thank you for helping us get the word out. We look forward to the time when we have a large number of doses of vaccine, and we are at the point of hosting larger community events that are open to anybody who wants to get vaccinated, and volunteers could help greatly with some of those efforts. So people can go to doh.sd.gov to sign up.
Thank you, Madam Secretary. Dr. Clayton, at this time we are going to open the floor for questions. If you could please identify yourself, your outlet, and then ask your question. Who would like to ask the first question?
Abby Wardrow, Capital Journal. Radio.
I heard Abby Wardrow. I apologize. Go ahead.
That's okay.
So in Senate Health and Human Services this morning, a bill, a mask mandate bill, was motioned to move forward into the Senate, and one of the senators had a question about why the Department of Health wasn't in the room supporting the bill. So are you guys aware of this bill? Do you guys support a statewide mask mandate? What are your thoughts on this?
Abby, thank you for that question. We were not in the room. We were actually in our appropriations meeting and for the next year's budget. But nevertheless, we will continue to get information out about what people can be doing to mitigate the risk of spreading COVID, and that does include mask wearing. Governor Noem and we do not support a mask mandate. And we've talked about this before where mandates really shouldn't be needed for people to do what they need to do to stay safe, and we will continue to encourage people to that.
Next question, please.
JPKOR News Radio.
Go ahead, JP.
Thank you very much. Regarding the pharmacies going to be distributing vaccinations, will they be following the particular group classification, like, from 1B, C, D, et cetera, ongoing?
Yeah, JP, thank you for asking that. We should have had that in our talking points. We have been in communication with those pharmacies, and they will be following the state priorities. And so, just like with our phase 1 vaccinators, we have very routine communications to make sure that we're vaccinating people consistently across the state, and that group of retail pharmacies are now part of those communication efforts, and they will be following the state priorities.
Okay.
Thank you.
Next question, please.
This would be Havapara with CIV.
I heard KIV.
Did you get Havapara with KTIV?
Yes. Go ahead.
Okay. So South Dakota ranks 5th in the country for percentage of COVID-19 vaccines administered, with 82% of vaccines distributed already administered. What would you say is the biggest factor to having such a good percentage?
Well, thank you for that. I think, a lot of our success goes back to some of the key tenets of our response so far. First of all, Governor Noem gave the State Department of Health flexibility to create a plan that was common sense and makes sense for South Dakota, and has also provided us with the resources needed to do the planning work in this area, which we started back in August. So we've been having conversations about vaccination and what this might look like with stakeholders and with healthcare providers, for several months now. In addition to some of those planning efforts, we have, really worked hard on, relationships with the media so that you would have the best information possible to share with people in an effort to be transparent about what we know, what we don't know, and where we're heading. And so those partnerships have been important, that transparency, what we have out on our dashboard so that people know exactly where we're at. And, continuing to have these calls so that we can provide you all with the latest update. This has been something that has evolved every single week, and so it's important that people understand, just exactly what we know and where we're going with this. Definitely, we at the department level have taken ownership of this issue and leadership, but it is an all-hands-on-deck effort, and so we've got many, many partners out there that have stepped up, asked to help, and as our allocations increase, I know we are up to the task to continue to be a leader across the country.
Okay. Can we please have the next question?
This is Kelly Hertz.
Deb with the Black Hills Pioneer.
I heard Kelly Hertz, and then we'll go to Deb.
Thank you. We're wondering, with pharmacy vaccinations, will the state be keeping track of what the pharmacies get, and will those be reflected in the state numbers on the portal?
Sure. So those vaccines, after they are administered, are required to be reported to us, and so they will be reflected numbers of people vaccinated. I'm not entirely sure what the process will be for us to understand the number of doses that they are getting. We are still kind of working through some of those processes as the federal government is figuring out that piece on their end.
Okay. I believe our next question is from Deb.
Yes, my question is, when will the teachers be moved up onto the priority list? I'm hearing that they're ready to get their shots.
Thank you, Deb. Again, we are currently in the 1D population, and that includes everybody over age 65 as just one group, along with people with 2 or more underlying health conditions, teachers, and funeral care workers, as well as high-risk residents of congregate settings. So it's a pretty large group. It's 265,000 people. Where we started with that group, because our allocation at the state level is very limited, is we started with people over age 80. And as I mentioned, next week we'll be able to drop that down to people over age 75 and older, as well as people with very specific health conditions that put them at increased risk of poor outcomes, and that includes people on dialysis, people who are post-transplant, and people who are actively battling cancer. And then the third group that we have started with are those high-risk residents in congregate settings, because again, we know that they are at risk of poor health outcomes. So we are going to continue to work through those initial groups, get through the age 65 and older population, and then transition to the people with 2 or more underlying health conditions, and then teachers and others become eligible. Now, I just want to remind people that if they become eligible maybe they're eligible in a couple of different categories, they do become eligible for vaccination at the first category that they would qualify for. So if you have a person who's a teacher who happens to be over 65, and we're vaccinating 65-year-olds first, that teacher would become eligible then, and that applies in a lot of different situations.
Okay.
How long are you thinking before all teachers?
Yeah, we just don't have the information about what our state allocations are going to be able to predict that very well. We do have a tool on the website that shares, at this point, we anticipate, really using February to continue on the populations that we're working on right now, and that it will not be before March that we are able to get to teachers and those others in 1D.
Okay, thank you.
You're welcome.
Next question, please.
John Wynn with SDPB.
Go ahead, John.
This is kind of a follow-up to the previous question, but are certain State Department employees getting vaccines for the current phase? For example, everyone working at the Health Department or Social Services?
So if you, again, if you look at the graphic that's on the website about the priority populations in South Dakota, the 1C population included other healthcare workers, public health workers, emergency medical services, law enforcement, and correctional officers. And so to the degree there would be state agency staff that fit into those categories, they would have been eligible in 1C.
Okay. Next question, please.
Ray from Kelland.
Go ahead, Ray.
Hi. When you look at a couple of factors, including the vaccine allotment, the new strain that's expected to be dominant in March, and then you look at testing's never been easier, but testing numbers continue to drop. Is the DOH concerned about that, and would there be any plan to do any more mass testing or
This is Dr. Clayton, and one of the things that I'll mention is that we know that part of our initial concerns early on during the pandemic was just what did we have for capacity for COVID-19 testing within the state. We have seen that between what our health partners have been able to bring on for testing, the support from the public health laboratory for certain populations, as well as commercial laboratory, that we have ample capacity to be able to test all individuals who have symptoms for COVID-19, as well as those who are at increased risk because they have come into contact with a person infected with COVID-19. We continue to make recommendations that individuals in those groups be tested, and that there's, what we're seeing in terms of our decreasing numbers does match, I think, the decreasing cases that we've seen overall. So I think that's perhaps a little bit more reflective of decreasing number of individuals presenting with COVID-like symptoms that are being tested by their medical provider. But, we do have substantial capacity within the state to test. We do have capability of pulling the positive tests for that strain surveillance as well. And so expect that, we are able to identify a new strain if it were to arise in South Dakota. And the last thing I just mentioned is that we do have free at-home testing through a partnership to do that saliva-based testing. And so that going to the covid.sd.gov website, individuals who either believe they've been exposed or have been specifically identified by someone that they know of that's been a close contact is able to have yet one other way of receiving that testing at no cost to them.
Okay. Next question, please.
Morgan at the Rapid City Journal.
Go ahead, Morgan.
I just wanted to follow up from the question from public broadcasting. Have you and Kim Nelson-Risen, Joshua Clayton, Daniel, have you all gotten your vaccines yet? Since I guess you might be the public health workers in 1C.
Morgan, this is Secretary Nelson-Risen. I received my first dose of vaccine.
This is Dr. Clayton. I have received my first dose of vaccine as well.
I have not just yet.
Okay. Can we have the next question, please?
Yes, this is Jerry at WNAX. Maybe a follow-up for Dr. Clayton on the variants. As you say, it's a matter of time on that. If and when they're found, will that change your recommendations because it is apparently more transmissible, face mask, social distancing, all that?
So what I would say is that, with each variant, there's a different potential for transmission, potential impact to whether antibodies through and then through vaccination are effective at preventing disease. So we do need to learn as much about these variants when they do emerge. With that, we know that some of the perspective that we have with increased risk of transmission with some of these variants, it does mean that we will need to be more focused on our prevention measures so that we can decrease the risk of transmission. You may have heard some discussion at the federal level about whether there might be a recommendation to wear 2 masks or to wear a higher level of mask, potentially moving away from cloth masks as some European countries have done. So the effectiveness, of those masks is not in question. It just comes down to providing a higher level of prevention through, say, manufacturing standards for a medical grade surgical mask as opposed to a hand sewn cloth face mask. So I would say that it continues to evolve, and that we continue to monitor what we can do on the pharmaceutical side for vaccines and how effective they will be against these variants, as well as redoubling our efforts for our prevention measures that we've espoused since the early part of the pandemic.
Okay. We have time for one more question. Can I please have the last question?
Hey, this is Jonathan with the Argus Leader. If no one else has a question.
Go ahead, Jonathan.
Just curious, you guys are calling it the UK variant. I didn't think we were supposed to name diseases after geography areas. Do you know how it got that name?
Yeah, so the B117, also known as the UK variant, is just because it has arisen out of the United Kingdom. What I would say is for briefings like this, I think it's beneficial to make sure that we're speaking about the same variant. But yeah, in the scientific literature and on CDC's website, they focus on differentiating the variants by the genetic lineage, B117 versus B1351, for those different strains as opposed to the location where they have originated.
Okay. We would like to thank you all for participating in today's meeting.